Are you tired of feeling confused and overwhelmed by the world of health insurance? Are you unsure of what plan is right for you, or how to navigate the ever-changing landscape of healthcare? Look no further. In this video, we're going to demystify the topic of health insurance and arm you with the knowledge you need to make informed decisions about your healthcare. Whether you're new to the topic or just looking for some refresher, you won't want to miss this. So, sit back, relax, and let's take a deep dive into the world of health insurance together. In our last video, we covered all the important things you need to know about health insurance and looked at different types of health plans. In this video, we'll be showing you how to get your hands on affordable health insurance, how to choose the best plan for you, and where to check if a health plan is good quality. One of the biggest benefits of health insurance is that it provides financial protection against unexpected medical expenses. When you have insurance, you don't have to worry about how you're going to pay for a sudden illness or injury. Your insurance company will pick up a portion of the bill, which can be a huge relief. It also provides access to a wide range of healthcare services. With insurance, you can see a doctor for a routine checkup or a serious illness, without worrying about the cost. You can also get preventive care, such as vaccinations and screenings, without incurring additional expenses. Additionally, many health insurance plans cover prescription drugs, mental health services, and other specialized treatments, which can be essential for managing chronic conditions or recovering from an illness. On the other hand, health insurance can be expensive. With premiums, co-pays, and deductibles, it can be tough to pay for it all. Also, some health insurance plans only cover a limited number of doctors and hospitals, so it might be hard to find a doctor that's covered by your plan. Some plans have limits on how much they'll pay, like an annual or lifetime limit, which means you might have to pay for things that go over that limit. Some plans don't cover every type of medical care, so you might have to pay for that yourself. It can be confusing to understand what's covered and what's not, and if you change jobs or become unemployed, you might lose your coverage. There are several ways that low-income family can afford health insurance, including Medicaid. Medicaid is a government-funded health insurance program that provides coverage to low-income individuals and families. Eligibility for Medicaid is based on income and varies by state, but in general, it is available to people with low incomes. The Children's Health Insurance Program, CHIP. CHIP is a government-funded health insurance program. It provides coverage to children in low-income families who do not qualify for Medicaid. Marketplace subsidies. Under the Affordable Care Act, ACA, low-income individuals and families may be eligible for subsidies to help them purchase health insurance through the healthcare marketplace. Community health centers. Community health centers provide low-cost or free primary care to low-income individuals and families, regardless of their insurance status. Employer-based health insurance. Some employers may offer health insurance to their employees, and for low-income people that can be an option. Short-term health insurance. Some people may choose to purchase short-term health insurance, which can be less expensive than traditional health insurance plans but typically provides less coverage. Check your official state health website. Catastrophic coverage. Catastrophic coverage is another option, which typically provides coverage only in case of serious illness or injury, and it is a less expensive option than traditional health insurance plans. Spouse's health plan. If your spouse has job-based health insurance, you might be eligible for the same coverage. Most employers extend the offer of job-based health insurance to their employees' spouses, children, and stepchildren. Parents' health plan. If you're younger than 26 years old and your parent has a certain kind of health insurance plan, you might be able to get covered. You can be covered as a dependent if your parent has an individual market plan that was purchased on exchange or off exchange, or a job-based plan that offers coverage to dependents. You can still get covered even if you're not your parent's tax dependent, you're married, or you're living on your own. It's important to note that the availability and specifics of these options may vary depending on the state you live in. It's always best to check with your local authorities, healthcare.gov, or consult with a financial advisor for the best options for you. Note: dental and vision coverage are not typically included in traditional health insurance plans. However, many insurance providers offer separate dental and vision plans that can be purchased in addition to a regular health insurance plan. These plans may provide coverage for routine checkups, cleanings, and certain procedures such as fillings or orthodontics for dental plans, and for eye exams and glasses or contact lenses for vision plans. Additionally, some employers may offer these types of coverage as part of their employee benefits package. It's always best to check with your insurance provider or employer to see what types of coverage are available to you. It's important to make an informed decision about what type of coverage is right for you and your family. It's also essential to understand the terms and conditions of your insurance plan, and to be aware of any restrictions or exclusions. How to choose health plan. Choosing the right health insurance plan can be a daunting task, but it's important to remember that you have the power to make the best decision for you and your family. The first step in choosing the right health insurance plan is to understand your healthcare needs. What type of medical services do you and your family typically use? Are you managing any chronic conditions that require specialized treatment? Do you have any upcoming medical procedures planned? Knowing your healthcare needs will help you determine what type of coverage you need. Next, you'll want to consider your budget. How much are you willing to spend on monthly premiums, co-pays, and deductibles? It's important to remember that the cheapest plan may not always be the best option for you. Sometimes, it's worth paying a little more for a plan that offers better coverage for your specific needs. You'll also want to consider the provider network associated with the plan. Does the plan include the providers you prefer to visit? Does it include the hospitals you prefer? A plan with a more extensive network of providers will likely offer more options for you and your family. Evaluate plan options. Research and compare different health plans offered by different insurance companies. Look for plans that cover your healthcare needs and have affordable monthly premiums, deductibles, and copays. It's also important to check the plan's coverage restrictions, such as annual or lifetime limits, and exclusions, such as not covering certain services or treatments. Some plans have coverage restrictions, which means they will not cover any expenses that exceed that limit. Once you've considered all of these factors, you can begin to compare different health insurance plans and their costs. The government website healthcare.gov is a great resource for comparing plans and costs. Check the quality of the health plan. Look at consumer ratings and reviews of the plan, as well as the insurance company's customer service and claims handling process. It's also important to remember that health insurance plans can change from year to year, so it's a good idea to review your plan and compare it to other options every year during open enrollment period. Get help if you need it. If you need assistance choosing a health plan, consider speaking with a licensed insurance agent or a health insurance marketplace navigator. Where to check quality of health plans. National Committee for Quality Assurance, NCQA, ncqa.org provides information on health plan accreditation and ratings. Centers for Medicare and Medicaid Services, CMS, cms.gov provides information on the quality of Medicare Advantage and Medicaid plans. healthcare.gov. This website provides information on the quality of health plans offered on the individual market and helps you compare plans based on their cost, coverage, and quality. Your state's insurance department. Some state insurance departments provide information on the quality of health plans in the state. In conclusion, health insurance is an essential safety net for protecting ourselves and our loved ones from the financial burden of unexpected medical expenses. It's important to understand the different types of health insurance plans available, and to research and compare their benefits and costs to determine which one is the best fit for you and your family. The key is to make an informed decision by understanding your healthcare needs, budget, and provider network, and to be aware of the terms and conditions of your insurance plan. So, it's time to take control of your health, and ensure that you and your loved ones are protected with the right health insurance plan. Thank you for watching the video, and I hope you had an amazing time watching it. Don't miss out on any of the future videos. Press the like button, subscribe to my channel, and hit the notification bell to stay updated on all of the latest content. Make sure to share it with your friends and family so they too can join in on the fun and learning. Leave a comment below and let me know what you liked about this video and what you'd like to know more about. Your feedback will help create content that is relevant and interesting to you.